Time now is 2:16. It's Shay here on BBC Radio London until 6 p.m. Now, kicking off the show today, wanted to shine a light on a major new development within HIV prevention for Black heritage communities right across our city. From January to April of this year, One Voice Network is rolling out a bold pan-London programme. It's bringing HIV testing, prevention and support directly into communities. It's called the Do It London campaign, and it's brought forward by the London HIV Prevention Programme. It's a response to findings from last year's Towards Equity report, which exposed the deep inequalities still shaping access to HIV prevention. I'm joined in the studio now with Mark Thompson, who's lead commissioner of the London HIV Prevention Programme, alongside Susan Cole, who is executive director at Phoenix Healthcare. Pleasure to have you both here. Thank you for coming in.
Lovely to be here, Shay.
I'm going to come to you first, Mark. Can you give us a little bit more of an understanding in the context? Because from what I've read, the programme was shaped by the Towards Equity report last year. But what did that report actually reveal?
Yeah, it's great to be here, Shay. Thanks for having us. So the Towards Equity report came out of the London HIV Prevention Programme's need to better understand the HIV prevention needs of Black heritage communities.
Okay.
And what it showed us was that structural barriers, stigmas are still big issues which prevent Black Londoners from engaging in HIV prevention. For example, people not being able to access clinics when they need to, or understand where they can get HIV testing. Stigma may also be an issue for people because they may be concerned that having a HIV test result will have an adverse impact on themselves, their relationships with their families. And
so how do you then even try to approach that, in a sensitive way, which is understanding of those cultural needs, if you will? How does this all come about with the Do It London campaign?
So Do It London campaign is a London-wide campaign which speaks to all Londoners.
Okay.
But what we recognised from the research was that Black Londoners needed services, campaigns, interventions that were designed by them, delivered by them, which is why we were really proud to commission the One Voice Network to deliver their programme, Skin Like Mine. Co-production, working with our communities is essential if we're going to meet their needs.
So how are people reacting to this? Because as I mentioned, it's from this month up until April 2026 with regards to One Voice Network rolling out this programme. What's the initial kind of response been like to this?
Well, Susan, who's been working on that, can tell you some more about that.
Yes, please. Enlighten us. How has it been, Susan?
Absolutely. So One Voice Network is a collection of Black-led HIV organisations.
Okay.
And we're leading the Skin Like Mine programme, actually sharing messages around HIV prevention, talking about HIV PrEP in the community. So it's very much an initiative by and for us. And the response has been incredible. We've been going out to community centres. We're actually going to be in Stratford Shopping Centre.
Okay.
So we're actually going where communities are. And I think it's absolutely crucial that these messages are by people from the communities, because we really understand what resonates with communities.
And what are some of the things that Black Londoners have been telling yourselves, whether it's you personally or perhaps anyone within One Voice Network? What have they been saying?
So in relation to HIV, what people have been sharing with us is that their health is really important for them. But what is the problem? Often are the structural issues, the barriers to accessing care, going to the doctor and not being believed or not being listened to. These are issues that have affected Black people for generations across so many disease areas. So it's understandable why people may not want to go and talk about HIV, and actually having initiatives where people can talk to people who understand and also talk about stigma that affects so many communities, and also just so many different issues that are affecting people's lives as well that can be a barrier to be accessing care.
Comes across really, Susan, what you're saying is through meeting people where they're at, you're really humanising this conversation and ensuring that no one feels feels like the other. And however a person wants to have that conversation around their health or get an understanding around HIV, they're able to do that with people who understand them and where they're coming from. If I can bring you back in on this, Mark, in terms of on the ground, Susan just mentioned there that you'll be able to see One Voice Network, let's say in Stratford Shopping Centre. Can you paint a picture maybe more so of what Londoners will be able to see on the ground up until April then?
Yeah, absolutely. So the Skin Like Mine programme will be out and about at different spaces like Susan has already mentioned.
Yeah.
We're also looking at working and doing really interesting pop-ups, looking at tying it with beauty and wellness, how we might work with nail salons and barber shops just outside of the usual community spaces. So what Londoners will see are amazing volunteers who are fully trained up and fully skilled up that can talk to them in confidence about the issue, maybe offer them a HIV test there and then, or sign them up to get an online testing kit from Sexual Health London so they can do that in their own time, answer all of their questions. One of the things that we learned from our report is that many people from Black heritage and racially minoritized communities understand that HIV is an issue, but very often think it's something that affects somebody else.
Not them.
Yeah. So what we're trying to do is to bring that into community, not to stigmatize people more, but just say, you need to be aware of this and there's something you can do, and getting tested is a really good thing for your health, for your family, and for our wider communities.
Is it almost about kind of breaking down some of the stereotypes then? You know, when you talk about, you know, various communities thinking, oh yeah, this isn't our problem, or this isn't something that happens to us. Is it just around about, I don't know if normalizing the conversation is the right way to say it, but essentially ensuring that whatever these stereotypes that people have, sometimes it can be misinformation that's shared on social media, is then broken down for people to understand that it's palatable information and it's simple to talk about.
Absolutely. We are trying to change a narrative. We're trying to break down those stereotypes and the stigma, because HIV can affect absolutely anybody. We know it disproportionately affects gay men, and we know it disproportionately affects Black communities in this country and Black women in this country. So we want to do that work, and by working with organisations like the One Voice Network who have their experience and have people who also have lived experience able to go out. And we've seen that around blood donation and sickle cell and all these things that impact our communities. When we speak about it, people listen.
Can I just pick up on that, and then I will come to you as well, Susan, but you just mentioned, because I think some of our listeners may genuinely be surprised, you mentioned one area I think a lot of people know in terms of the ways in which HIV does affect the gay community, not necessarily the point that you just said there around Black women. Can you elaborate a little bit more on that, please?
Absolutely, yes. We look at our epidemiology, which is provided by the UK HSA agency, which provides all of our data, and we know that Black women in this country are the second largest group impacted by HIV, and that has to do with all of the reasons that Susan has mentioned, you know, structural issues, stigma, women not having the ability to be in control of their health and well-being. This is why HIV prevention tailored for and by women, which is accessible, is really, really important. And really quickly, globally, more women are impacted by HIV than men.
That also, I suspect, is a bit of a misconception people may not even know about. Susan, what are Black women saying to you, to the organisations that you're working with about this?
As Mark said, I think lots of women don't think that HIV is something that's going to affect them. And then also, there's so much misinformation around HIV. Many of us will remember the tombstones and icebergs campaigns around HIV. So there's a lot of fear about it. But the reality is that HIV has changed. People on effective treatment can't pass HIV on to their sexual partners and can expect to live as long as anyone else. Women on treatment can have children born free of HIV. We can do any job that we want to do. However, stigma still acts as a barrier to testing, taking treatment, staying engaged in care. So it's really important that people have the correct information to make the informed decisions about their own health, because ultimately knowledge is power.
Yeah, completely. I think many people will be nodding away as you say that. Give us details. I know that people can go to doitlondon.org, can't
That's
they,
correct,
for more
yes.
information. So is that the place for everything then, Mark, in terms of this programme, or throughout the whole programme as well?
So if you want to learn more about what the London HIV prevention programme is doing, visit doitlondon.org. And Susan can give you some links.
Please,
for
more. Give us more detail,
yes,
please.
so you can go to One Voice Network Work 2 on Instagram,
Okay.
NAS Project London, and also Phoenix Health M.
Lovely. I'm going to repeat all of those. So 1 Voice Network 2 on Instagram, NAS Project London, and it was also Phoenix Health
M
on Instagram, and then also on that website, as Mark's mentioned as well, doitlondon.org. It would be great to follow the journey. Can you come back?
We'd love to come back.
Both of you, it'd be really nice to see how things go, you know, come April time and what the response is like. And I suspect actually this will probably follow on throughout the year.
Absolutely.
It doesn't feel like this is just going to be like a one-off thing.
It's not a one-off thing.
Yeah.
What we are looking to do now is to commission a program which will run for the rest of the year up until March 2027,
Amazing.
which will then expand and take this right across the capital. We've got some really exciting work which is coming down the line, which has never been done before for Black Londoners. So we're really excited. We're looking at innovation, creativity, and going where our communities are. They deserve this.
Absolutely. That's what it's all about, and having that conversation. So I look forward to seeing you both in April. Thank you so much, Mark and Susan. Again, that website, doitlondon.org.